Did you know that 50% of depression patients start at the age of 14 years old? Me, myself, I have struggled with depression ever since the age of 15. There were days I'd wake up and I wish I didn't wake up. I just wanted the pain to stop and I felt all alone. My whole family struggles with depression, and most of my family members are on medication. In order to understand depression, you need to realize that you are not alone. I know that many of you in this very class probably suffer from this disease. Depression is a disease. It is important for you to listen to this speech and understand that depression, because we are all in this together. The number one controversy of depression and anxiety are antidepressants / medication. Some of you may be taking some kind of medication to help. And guess what? That is okay. And some of you may be finding this with absolutely no help. And guess what? That is also okay. I just want to inform you of everything that you can do so you yourself can make the right choice for yourself and be happy within yourself. So depression is a major issue in today's society because nearly 10% of the world suffers from this disease, and it is very serious. So what is an antidepressant? What are the good and bads of the medication? And what should you yourself do? Mental illness is no joke, and you have the choice when it comes to battling this disease. So let's first examine the controversy between taking antidepressants and not taking antidepressants. In order to understand anything, you need to know what an antidepressant is and why they are so controversial. An antidepressant is a drug given to you by a doctor to help keep you feeling happy when you need help. In an article by Very Well Mind by Nancy Schimpfeling, she says, depression is a common disorder that affects the chemistry and function of the brain. Antidepressants can help correct the dysfunction by altering the circuits and chemicals that pass signals along nerve routes into your brain. Basically stating, an antidepressant helps the mind feel strong again. It is a support for your brain. There isn't just one antidepressant though. There are lots. This is why antidepressants are controversial. There are so many different kinds to help with different scenarios that you're struggling with. So this is what Schimpfeling had to say. There are 5 major classes to antidepressants and several others that are less commonly used. Each has its own benefits, risk, and appropriate uses. While some may be considered preferred options, the drug selection can vary based on your symptoms, history of treatment, and coexisting psychological disorders. Yes, these antidepressants may help you in some ways, but there are lots of side effects that could affect you in the process and possibly make things worse for you. So, now that we know exactly what an antidepressant is and why people are so stuck on trying to decide whether to take them or not, we need to look at the good and the bads of antidepressants. Antidepressants have many good effects and also have many bad effects. So it's important for you to pick the right one if you decide to get on these medications. Let's first look at some of the good effects of taking antidepressants. Well, first of all, they do help you feel better in some ways. That's just the truth. The drug is made to make you not depressed and able to function throughout the day like normal. It's a drug to basically help you not feel depressed in the end. The point of the drug is to help your brain eliminate the effects of depression. And most antidepressants will do this. Like I said earlier, it is a stability for your brain. Now let's look at some of those negative effects of taking antidepressants. In a journal written by Arthur Allen called Coping with Side Effects of Depression Treatment, he lists some of the most common side effects of antidepressants: nausea, increased appetite and weight gain, loss of sexual desire, fatigue, drowsiness, insomnia, dry mouth, blurred vision, constipation, dizziness, agitation, irritability, and anxiety. And that's just some of the side effects. That goes to show you that is it really worth it? Yes, you may cure your depression, but are you getting this? But after getting these side effects, that it's almost like your life is more miserable. We now know some of the good and the bads of antidepressants. It's up to you to make the choice. In the end, it's your choice, whether they would work for you or not. Depression is a health problem. It is not something you can control. You may be able to change your life to help in some ways, but if all else fails, and are still having like these bad thoughts, you should talk to your doctor immediately about receiving antidepressants. Every single human being is different. We're all different. And everyone battles things their own way. If you are confident that you can take this challenge on by yourself, go for it. If you are struggling so bad and it keeps getting worse and worse, and you're having bad thoughts such as suicide or hurting someone else, you should see a doctor immediately so they can help you. There are many online websites that can help you with deciding if taking antidepressants would be right for you. A good website is Sigma, made by Healthway staff that have made lots of quizzes to help see if your brain is ready for antidepressants. This decision is on your own to make the choice. It is important for you to make this choice, but you shouldn't just jump into taking antidepressants, says Dr. Jane Erb. Everything in life takes time, and there even is some research that some antidepressants won't work for minor problems. You need to make sure that they work for you, so that way you don't dig yourself a bigger hole. In conclusion, the choice is yours, and yours only. Don't let anyone decide what you put into your body. I hope this speech was helpful, that you get better understanding of what depression is and what an antidepressant is as well. I also hope that you know what the good and bad effects of taking these medications and how to make the right choice when it comes to your body. Depression is a major issue in society. All mental illnesses should be taken seriously and not seen as some joke. We are all in this together. Remember, make the right choice for you.